Too often, healthcare providers in New Zealand have to wait for information about the patients they are treating, sometimes having to rely on the patients themselves. New Zealand is one of the few remaining fully economically developed countries that does not have some sort of national electronic health record system. The consequences of a delay in getting necessary information can range from incorrect diagnosis, mixed up prescriptions, or even death. We will now analyze the problem by discussing the causes and the symptoms. The main cause is that New Zealand's healthcare information systems between district health boards and other service providers developed separately so that barriers of differing technology systems and administration processes were erected against easy communication. Other causes include customer concerns over privacy and security that hinder support for an EHR system. Lack of media exposure and government statements about such a system has also delayed public support and funding.
The problem that I face on a daily basis is not having quick access to the patient's current medical record, what their list of problems are, what medications they're taking, if they've had any procedures done recently, if they've been hospitalized. I don't have access to records from their GP. I don't have access to records from other DHBs around the country, and it just slows everything down.
Our interview with Dr. Conger made it evident that our current system can delay treatment. This can stem to further problems such as redundant appointments or forced decisions in emergencies when time is of the essence. As mentioned before, this can result in medical problems being intensified instead of remedied. So, what's the solution? The first step is to centralize the information. This means connecting all of New Zealand's district health boards, specialists, pharmacists, and other healthcare providers through one national electronic health record system, which uploads data in real time so that doctors have the information they need right when they need it. How will we make this innovative? By having a two-factor identification security system to address consumer concerns over privacy. To access the records, two keys will be needed, one from the doctor and one from the patient. The patient's key will be biometric, a fingerprint so that if the patient is unconscious in an emergency, the doctor can still access their information. A key performance indicator will be the percentage of customer complaints over their treatment resulting from delayed and/or incorrect diagnosis or treatment, which should be significantly reduced by a secure EHR system.